Dr. Lewis is a world-renowned expert on brain health and the use of omega-3s for the prevention, management, and rehabilitation of concussions and traumatic brain injury. His pioneering work has helped literally thousands of people around the world who are on the brink of death. He has been featured in the media several times, including a feature story on CNN, Sanjay Gupta's show, so I invite you to watch that as well. He is a graduate of the U.S. Military Academy at West Point and the Tulane University School of Medicine. At the end of 2011, Dr. Lewis retired as a colonel in our U.S. military after a distinguished 31-year career. So please join me in welcoming Dr. Lewis.
Thank you, Carrie. A bomb goes off in Boston, the Boston Marathon, and the second one goes off. A couple people are killed, a lot of people, hundreds of people are injured. A couple days later, an explosion in Texas, levels a mile around from this fertilizer plant. A couple people are killed, hundreds injured. Gives the American public a view of what the U.S. military has been dealing with for over a decade. These are the scene injuries that we observe of the survivors of IEDs and other things going on in Iraq, Afghanistan. But what really worries me is the ones that we can't see. The head injuries, the invisible wounds. But what worries me even more is that we have 44 or more million kids just in the United States who play organized sports, and the kids are getting bigger, they're stronger, they're faster. If you watch the Super Bowl, these guys are monsters. If you look at how big and how strong our sports quote-unquote heroes have become, it's amazing. And athletes continue to play through injuries because it's an invisible wound, a concussion. You know, suck it up, get back in the game. Well, if you have a brick wall and it gets damaged, I took the simple approach when I got into this field that, wouldn't you want to use bricks to repair that wall? Just made basic, simple sense to me. Well, omega-3s, DHA in particular, are literally, as we've seen through some of the other basic science type of presentations, DHA literally are the bricks of the brain. So I had the idea, why can't we use DHA and omega-3s to help the brain repair? And that's what we're going to talk about through today. Now, why are we talking about low omega-3 levels? Why are they a concern in traumatic brain injury? Well, actually, Bill Lands would probably argue that, in reality, we have an omega-6 problem, because the omega-6s really are the problem. But I'm dealing with acute injuries, and so we're not going to be able to lower the omega-6s in an acute type of fashion. So I'm taking the other approach. I'm looking at what can we do to plus up the other side of the equation, the omega-3s, and help the brain heal. Well, what is a concussion? Most people think they know what a concussion is, and if you played high school sports, you probably were exposed to them. I myself can tell you I've had 4 concussions, and I can tell you where, when, why, how, and all that. 2 in the military, 2 in high school, and they just happen. It's part of our culture of playing sports. But what you don't know or may not know is that a concussion, which is also a traumatic brain injury, don't confuse the two. A concussion is a traumatic brain injury. It's just the primary injury, the tissue insult, a mechanical energy that's transversing the brain in one way or another, whether it's a bullet, whether it's a blast wave, whether it's hitting the windshield of a car, or whether it's a helmet-to-helmet contact. But what's really important, and what you need to, if you take away nothing else from this lecture, is that there's a secondary injury that is far more devastating. And this secondary injury is this biochemical cascade that goes on for minutes to hours to weeks to even months. And this process continues and causes far more damage in a lot of cases than that primary injury. If that primary injury didn't kill you, the secondary injury may not, or may eventually kill you. And that's why people die a week or two or even a month later after a severe head injury if they didn't die from the initial insult. Well, that secondary injury creates a lot of havoc in the brain. Creates ischemia, axonal injury, neuroinflammation, cerebral edema. And we have edema and inflammation going on inside the skull. There's no room for it to go. And neurosurgeons on the battlefields of Iraq and Afghanistan started to figure out, what if we remove part of the skull to let the brain swell without being trapped inside the skull? So the surgeons have taken this and have really run with it over the last decade. One of the things I want to really point out, though, with axonal injury is you've got this initial injury. And you think about it. The brain is made of different structures within it which have different densities. And we know that an object in motion is going to stay in motion until acted on. But if you've got a deceleration injury, a kid hitting the floor in a volleyball game, falling backwards and hitting the floor in a volleyball game, going up for a header and running into each other, those parts of the brain are going to be moving at different speeds, and there can be shearing. It doesn't have to be a car accident and hitting the windshield. It could be something as simple as falling down in the bathtub because you passed out, because you had the flu. These are serious things that happen all the time. And what happens is when you have that type of shearing, the neurons start to die. The axons start to die, and they die over a period of time, sometimes hours, days, maybe even weeks. Well, when you go to the emergency room after your car accident, they take a CAT scan. Well, they're not looking for diffuse axonal injury. They can't see it. All you can see is whether or not there's bleeding going on. And in this case, the case of Bobby, which you'll hear a little bit more about, you've got bleeding going on inside the brain. And the surgeon has to make a decision based on that CAT scan, not is there diffuse axonal injury, do I take this kid to the OR or not? Well, if kid survives and a week later, you can start to see the diffuse axonal injury. The areas that are all lit up in this side, you can see them pretty obvious here. But all this brightness around the outside here, that's diffuse axonal injury. Diffuse. The whole brain has been affected. And you saw what it can do. It can affect literally everything. So the neurosurgeons, out of necessity, have done an amazing work. The intensivists have done incredible work in the ICU and in the operating room. And we're able to control the intracranial pressure. We're able to control a lot of things in that acute phase. But that secondary phase, that secondary injury continues to go on and on and on. And just remember, it's not just the severe TBI, it's also those concussions on the football fields of America, on the soccer fields. Oop, there we go. So what about that secondary injury? What do we do after an injury? After the intensivist and the neurosurgeon have done what they can do to save that kid, that mom, that whatever. The problem is there is nothing. There is nothing. The art of medicine consists of keeping the patient amused while nature heals the disease. Voltaire. When I got into this field a couple of years ago, it was because I looked at what are we doing at Walter Reed for our soldiers coming home with traumatic brain injury. And I read the latest and greatest about what we're doing for our soldiers, and I came to this same conclusion as Voltaire. I said, we're not doing anything we wouldn't have done 500 years ago. And Professor Adina Michael Titus at the University of London corrected me. She said, that's not true. It's at least 1,000 years. Well, let's go to the CDC. CDC tells us, they're the public health force of the United States. Well, let's see what they have to tell us about treatment for traumatic brain injury. And actually, if you look at it and you go to the website, you go through it all day long, and what they call treatment is not treatment. It's recognition, diagnosis. They say treatment of traumatic brain injury is to recognize that you're having these symptoms and so on. That's not treatment. That's recognition. So they tell us to do certain things. Remove a kid from play if that's the case. Absolutely, vitally important. The most important thing that you can do. Okay? Physical and cognitive rest until asymptomatic. Well, for how long? Okay, what do you do with, now 90% of 90% of concussions that don't require hospitalization are resolved within a week, 2 weeks at the most. But what do you do with the ones that are continuing to have headaches or dysfunction weeks, months, even years down the line? Well, what we do now is we equilibrate treating symptoms with treating the problem. So if you have a headache, take Motrin. If you're having sleep problems, take Ambien. If you're depressed, take Prozac. You get 23-year-old soldiers come out of the hospital on a dozen different medications because every doctor they saw put them on another drug because they saw the symptoms and said, here, treat this, treat that. Now they're treating the symptoms and the side effects from the other drugs. 23-year-olds shouldn't be on any drugs. Nothing addresses the brain itself. Nothing addresses neuroprotection, keeping cells alive while you can and while you have that opportunity. Nothing addresses neuroinflammation. Nothing addresses neuroregeneration. As Joel Goldstein, who wrote a book about his arduous journey with his son over the last 12, 15 years, says, even the best trained, most skilled, well-intentioned professionals in the world suffer from tunnel vision. Neurosurgeons know neurosurgery. Intensivists know the ICU. Cancer epidemiologists think they know cancer epidemiologists. We'll let that go. But conventional medicine only takes survivors of TBI so far. Unconventional therapies, according to Joel, not only are not merely a reasonable option, they're a necessity. Why? Because there is nothing. Western conventional medicine offers these patients, these families, nothing. Well, how did I come to this? Well, in January 2006, there was the Sago mine disaster, and the guy up in the corner here, Randy McCloy, was the one survivor out of 12 or 13 miners. About 40 hours underground after the explosion. It was not a TBI, it was not a blast explosion. How he managed to survive, what he ended up with is severe carbon monoxide poisoning, methane gas poisoning, collapsed lung, liver failure, renal failure, and then had a massive heart attack and now no oxygen to his brain. And he was the last one alive when they pulled him out. And after hyperbaric oxygen and dialysis and everything that they could, they realized the kid had no brain left, basically. And so Julian Bales, the neurosurgeon in West Virginia, desperate to try anything, started throwing large amounts of omega-3s down his feeding tube, hoping miracle upon miracle that something might happen. Saturate the brain with what it was made of when Randy McCloy was an embryo in his mother's wound. God bless them, they published this as a case report. It was the first case report looking at using high-dose omega-3s that was put in the literature. I got to know Julian Bales over the next few years, and I started asking questions, and I went to the head of Walter Reed Research in Washington, D.C., and I said, is anybody looking at using omega-3s to help with our kids' recover from traumatic brain injury coming back from the war? And the answer was no, why don't you? Here's the money, go figure it out. So I started to put together programs to try to figure it out. I started to look at how to put together clinical trials, and then basically people started to find me. I don't know how, but they started to find me, asking me, my brother, my cousin, my uncle, my whatever, had a concussion, had a car accident. What do I do? And I had to start making things up because there was nothing to go on. And then one day I got a call, and I can tell you exactly when and where. It was Brain Injury Awareness Day of all days, and I was on the steps of the U.S. Capitol, and I get a call from the FDA. Except this was a different call. It was Jerry Cutt, who I was on a committee with, and he says, "This is not FDA business. This is personal. A friend of mine's son was in a car accident. Would you speak to the father about maybe using omega-3s?" I said, "If he calls me, I'll talk to him." He did, right away. And I had to think on my feet. I said, "I know where the hospital is. Go down the street. There's a Whole Foods. There's some brand, I think, called Nordic Naturals, and I think they have a concentrated liquid. Start pouring it down his feeding tube. Don't leave his bedside until they start doing it." How much? So I had to think about it. What did Julian Bales use? So I rounded it off to a tablespoon twice a day, or 30 mLs, 15 mLs, or 15 grams of fish oil concentrate liquid twice a day, or 30 grams, which provided about 19,000 grams of omega-3s, total omega-3s. The short of the story is the parents had been told this kid was not going to survive the weekend. Bobby went to his high school graduation 3 months later. He's now in college out in Los Angeles. This is the dosage that I recommended, as I just described. And subsequently, people started reaching out to me wanting to know if there was something they could do for their kid that's in a coma. Is there my father had a heart attack and he was without oxygen for 10 minutes or whatever. I get hundreds of emails all the time. My website gets between 700 and 4,000 hits every single day of desperate people looking for answers. Well, we thought we did the right thing as well. So Joe Hiblin and Joe was involved in doing the fatty acid levels and helping with this case. We published this as a case report in the literature as well. And then Joe just happened to mention he was talking to somebody from CNN, and CNN got a little bit interested. I ended up on the phone with Stephanie Smith, the producer at CNN, and she got really interested in this story. So she went out and they did interviews with Bobby and his family, collected photos, and she put together this amazing 8-minute lead-in featured segment on the Sanjay Gupta show in October a year ago, so about 15 months ago. And then subsequently also, they release a online portion of it as well. You reach people in ways you don't even know. Carrie Marshall calls me a couple months later. So that was the end of October 2012. A couple months later, she says, "Do you know about this?" And I'm like, "No." And I look it up. An 8-year-old near drowning victim in August is in a coma. The mother, in the end of October, sees the Sanjay Gupta show, goes to the pediatrician, says, "Can we try this?" They did. The kid woke up, and 2 weeks later, the kid woke up and was out of a coma. And Julian Bales got involved and published it as a case report. So now we have 3 case reports in the literature. So we're starting to build some evidence. Well, again, people are reaching out to me all the time. Well, next thing I know, I get a call and an email from Stephanie Smith at CNN, says, "Would you talk to the father of this son?" And it turns out that this is the son of a lady named J.J. Virgin, the Virgin Diet. She's a health and fitness guru. And her 16-year-old son was walking down the street, got plowed over by a car, hit and run, not expected to live. Basically reached out to me. I sent the information to the father. They did that protocol, that 30 grams of fish oil protocol, and it became another feature segment just a couple weeks ago on CNN because this kid is playing ping pong, going to the weight room, lifting weights, just months after his injury, and the parents literally were told, "Pull the plug, don't let this kid live. There's nothing here, let him go." And the parents refused to believe that. That's just the tip of the iceberg. Severe TBI is just the dramatic ones. What worries me again is those sports injuries, all those others. We don't know how many. There could be 2 million, 3 million, there could be 4 million just in the United States alone. We don't know how many others. So I had to design, off the top of my head, a way of addressing people. How do we deal with a protocol for that sports concussion. And it just, the way things kind of fell together, a little bit of happenstance, is I came up with this protocol of 15 grams of fish oil a day with capsules or liquid and taper it down. People say, why don't you start and build up? Because I want to make a difference. I can give just about, well, this is the wrong audience to do it because your omega-3 levels are actually probably crazy high. But I take an average person off the street. I did this with a 4-star general in the Pentagon. After Joe Hibbelin and I published a suicide study, showed that low omega-3 levels, low DHA levels correlate to a 62% increased risk of suicide in our active duty. The general says, be in my office, tell me what I need to know about omega-3s. And I pulled out a bottle and put it in front of him and said, here's what you're going to do. You're going to do this. And in 2 days, on the third day, it was a Wednesday night because Thursday he did it, Friday he did it, Saturday I got a call. The general's on his way down to the store to buy more fish oil. What should he get? I'm like, did he have any side effects? No. Did he have any, did he notice a difference? Yeah, that's why he's going to get down to get more. Interesting quote. Not only did he notice a difference, his staff noticed a difference, and, quote unquote, most importantly, his wife noticed a difference. In just 2 days of supplementing it. I want to make a difference so that people will know this works, and then we'll taper down. Or as a guy that had 3 Super Bowl rings from the 49ers back in the day of when the 49ers in the 80s and 90s, I deal with football players all the time, guys that hadn't played in 30 years. I said, hey, you should be down to the maintenance dose now. And he goes, maintenance? Hell, I'm still taking 15 a day because I like how it feels, and if I forget to take it because I'm traveling or working, whatever, I notice a difference. He hasn't played football in 30 years, but he notices a difference. We could also be using that maintenance level as a preventative thing as well. Well, I'm a physician, I'm a clinician, but I'm also a scientist, or at least a dabble in it. So we got to get some more scientific literature. We got to be able to support this. So with the help of Nordic Naturals, and I found a company that does EEG neuro brain mapping. And so what if we do brain mapping, give people high-dose fish oil for 5 weeks, and then do a brain map afterwards, and what's the difference? And I don't know if you can see all the numbers up here, but in every case, we only did 5 patients, but in every single case, we had a pretty dramatic, we haven't done the statistics yet, we haven't published this yet, but we got a pretty dramatic improvement in every single area. Let me point out one of them, and this is really amazing. This is a senior enlisted Marine who was a bomb technician. He goes out there and blows things up and tries not to get blown up himself. Suffering from multiple exposures, obviously, mild traumatic brain injury, PTSD, ADHD, and look at the numbers on, this is the neurocognitive test. Look at the numbers, memory, 40 to 90, executive and attention, 50 to 96, 31 to 94, 17 to 79, 33 to 71, 67 to 92. Amazing scores. The only thing he did different during those 5 weeks was 15 grams of fish oil a day. A different patient, not the Marine, but a picture just kind of lays it all out, doesn't it? What it looked like, and this is why I wanted to do a pre-treatment and a post-treatment brain map. And this is what I was hoping to see, and turned out better than I could imagine. This is not normal. But 5 weeks later, look at the difference. Look at the difference. It can be a hot debate, but what I will say is when we're talking about therapeutic amounts of omega-3s, especially in that acute phase of injury, you got to use a log scale greater than what you want to take for regular nutrition. The general said, I already take fish oil. And I said, not like this, you don't. So we got to be able to overcome those omega-6 levels. It'd be great if we could drop those omega-6 levels. That's the real answer. But in the absence of that answer, I'm going to plus up the other side because I know I can make a difference. So we need to overcome those ratios. We have to saturate the brain to be able to optimize the opportunity for the brain to heal. But omega-3s are just one tool. It's not the answer. It's one tool. There are no magic pills. There are no magic cures for traumatic brain injury. Omega-3s are not a cure. They're not a magic pill. It's nutrition. There will never be a cure for traumatic brain injury. Quote me on that. Okay? But once an injury occurs, we're left with trying to optimize the environment to give the patient, in the patient's brain, the best opportunity to regain as much functional capacity as possible. Those 16-year-old kid, that 18-year-old kid, they're not going to be 100% normal. They're never going to be able to return to that 100% level. It's not possible, but we want to maximize their possibilities. We need to find safe, viable ways to address traumatic brain injury. The best way is to avoid it, but in the absence of that, we need something. Every pharmaceutical that has been tried to date has failed, including they just stopped the progesterone trial. So what we need is something that is going to address neuroprotection, neuroinflammation, and even neuroregeneration. And the only thing I know that can do that is omega-3s. Thank you very much for your time.